This is a film about sanitation in the informal settlements in Namibia. Today, we are in the capital city. When it comes to sanitation, Windhoek is divided into two very different experiences depending on where you live. The city centre has excellent infrastructure, great roads, green suburbs, high-speed internet, and a range of shops and services. Here, clean water is on tap, and every house has a flushing toilet. But on the other side of town, life is very different, with virtually no planning or basic services. Windhoek is a tale of two cities, because even though Namibia has been classified as an upper middle-income country since 2009, the socio-economic reality on the ground is characterized by huge inequalities. So when you compare the sanitation situation here in the informal settlements with the wealthier parts of town, the informal settlements face a serious sanitation challenge.
So you find this is not a toilet, it's just a shower?
For the last 3.5 years, Shea Gottlieb of Development Workshop Namibia, a registered local NGO, has been working in the informal settlements.
And we are actually in Moses Karweb constituency, which is the largest informal constituency in Windhoek.
The lack of affordable land and housing throughout Namibia means that most Namibians are unable to buy land in the nicer parts of town. Poorer families construct makeshift shacks on the edge of town.
And you can see the structure of the households. They are basically not planned. People would just put up houses where there is available space. And this is also the reason why the informal settlements are expanding in Namibia, because it's very attractive to people from across the countries to move into the city, but they can't afford to be in a planned area to be able to afford life in the city. So that's why they opt for this area where you just occupy land, set up your shack, you don't pay rent, even though it's at the cost of minimal basic services such as water, sanitation, electricity, and even safety. Okay. So we're gonna go down. This is really an indication when where we're standing right now that the informal settlements are here to stay. Namibia is becoming urbanized. More and more people are flocking into cities, and so when independence came, everyone thought Namibia is for everyone, and the cities were very, very attractive. Coming here, the reality is this, actually.
Informal settlements are expanding so fast, the city of Windhoek cannot keep up with the demand for housing, safe water, and clean sanitation.
And there is no road access, so you can't drive in this area. So you walk in, you have to walk out.
Because these neighborhoods have no roads, municipal trucks cannot access these areas to remove the household waste. And because there are so few toilets, people defecate in open space.
Another main sanitation challenge in the informal settlements is the creation of solid waste island. You can see it's all wet, muddy, all the plastics, all the human feces. And this is also an area where communities that don't have access to a toilet would practice open defecation. It's a hazard to the environment and to the people, and also to the children. This is where they would also play, because it's also an open space. And these waste islands piles up with time, and there's no other way you can remove all this out of this area, as there is no access road. Communities around here find this area as the only area they can dump all their waste, household waste. So the children from here are always at the clinic with diarrhea and viruses that are related to unhygienic environment, as that we can see here.
Studies reveal that, in fact, Namibia has one of the highest rates of open defecation in the world.
And the smell here is really unpleasant, it's very, very strong. It's a mixture of many waste. So that's one person's house. So if you are having your meal there and it's close to an area like this, there is no way you can miss getting a bacteria or a virus. It's very, very obvious. We are now going to the more critical space of Nalitungwe, which is referred to as the sheet mountain. Actually, that's what the councillor told us first when we were first introduced to this area. He said, and this area here is a sheet mountain. It's reserved for sheet. Nobody can build here. So that's how. But it's actually true. Even the community are conscious that you don't build anything here because it's reserved for waste, it's reserved for this purpose. It's the only alternative because the city doesn't bring it out. And the tricky part about this mountain is that it's very close to a kindergarten. And so they would actually come run into the sheet mountain where you can see evidence of open defecation. If anything is to happen in this area in terms of outbreaks, I think the cost will be more here. This is the hotspot.
Today we are in Nalitungwe. Nalitungwe is a community in the Moses Garweb constituency. In December 2017, there was a hepatitis E outbreak in Namibia, which only ended in March 2022. Hepatitis E is a disease that is caused by poor sanitation and hygiene conditions. As a result of the outbreak, more than 8,000 cases were reported, which led to 66 deaths. And most of the cases were reported from the informal settlements.
Hepatitis E is a serious disease. It can cause death. It has already caused death in Namibia. And therefore all attention were given to end the outbreak. What I was really trying to avoid is the outbreak to turn into endemic, which means that you will always have cases of hepatitis E. That situation is untenable, and that is really what I set out to avoid. So the public must be taught about the disease, what are the signs and symptoms, but most important, how to prevent it.
As a strategy to address the hepatitis E outbreak, the community-led Total Sanitation Program, or CLTS, was initiated by UNICEF and Development Workshop Namibia with support from the Namibian Chamber of Environment and UNDP in close collaboration with the Ministry of Health and Social Services and the Ministry of Agriculture, Water and Land Reform and the city of Windhoek. The program then expanded to informal settlements in other regions with financial support from the European Union, B2 Gold Namibia, the First Round Foundation and other donors.
So CLTS is a behavior change approach which mobilizes communities to assess their sanitation and hygiene conditions and encourage them to take collective action to address the challenges that they identify with minimal external assistance.
When the first cases of hepatitis was reported, the informal settlements were the hotspots. When we were doing community sensitization here, we realized people did not know how to wash their hands. Different culture did not normalize hand washing. And there were many risk behavior that communities were doing that could promote unhygienic practices. And we also realized that communities here live very close to waste. So their food can be contaminated anytime. Their water can be contaminated anytime. For instance, the closest water tap is 3 kilometers from here. So, and if it's rainy season, you get your water from your rooftop or maybe near the riverbed. So that's how the cases were spreading very fast because of the practices that communities were doing.
Yes, what happened is that we then did the community mobilization through the process that we call CLTS training, triggering. And through that process, there was so much social awakening, and that communities themselves have started taking their own initiatives to address the sanitation challenges that they have identified. This they have done by building and using toilets, which stop the practice of open defecation, and then they dug soak-away pits, which address the challenge of having grey water running in the whole streets, improving the waste management within their communities, and at household level, set up tippy taps that is used for hand hygiene.
Maybe we can put it here most in all these areas.
The CLTS methodology uses a community bottom-up approach. Through a large network of CLTS volunteers, DW Namibia provides information for local residents. These volunteers, known as the Green Shirts, raise awareness by doing house-to-house visits and organizing local cleanup campaigns.
To the resident of Max Antongolume, we have a cleaning campaign on Saturday, 7:30.
Amerosali amaitina ondilio mwiyambi wo CLTS mo Max Antongolume otuli mo hatu ifamaonga na vajalumbi ja ugrina.
We must meet at this TP container. You can get your material here.
Tushivike mwana wa molukanda hatu yanju yelele unashanu ukoshoki unene tu okuitungila unju ovetweni okukalifa po oku omea tatondoka molukanda
otuneni oyawapalekolo lukanda letweni
okukalega punjolo ele unashani ni imbodi yetweni momalukanda etulisa imbodi yona ikalengota idampingwa pimapa popate te duro kupikingwa ponenga ateteni ko ataeta ko ke dumping site.
Thank you.
Onana uyelele unene hatu yanja mumalukanda opotukalege punene o hepatitis ayo yali moya londande pa ifopishu ni fapedo.
My name is Foibe Silvanes and I'm one of the volunteers that put on green t-shirt. I am from Havana, Katutura, Namibia. The green t-shirt that we are on the ground, we are trying our level best that at least we minimize the cases of hepatitis E. We give the information to the community, we sensitize and we change the mindset of the people. And we have seen that this type of work, this house-to-house visit, it's really helping, right? Yeah, we are just doing the inspection here. These are public toilets, so they are being used by, they are sharing toilets. This is really a national crisis because people in town, they have access to everything. They have toilet, but you here in the informal settlement, sometime where there is no toilet, you have to run behind the bushes. Even in the evening when it's not safe and there is no street light, there is no light, it's dark. You just do it behind your houses because you are afraid. And then when you do it behind your houses, this fly will go back with you in the house and they will also eat with you in your food and you get sick. The bad practice that they are doing, it's hepatitis E because we have cases of hepatitis.
The Green Shirt volunteers' house-to-house visits are all about sharing information with the community.
So I think house to visit will work.
Yeah. So we can at least see who is doing that so we can talk to them and give them the right information.
The program, the community-led total sanitation, is a very big contribution to the government efforts. To provide information to the community and also empower the community to build their own toilets.
The CLTS methodology also creates sanitation centers as focal points where communities can learn more about the practical methods to solve their own sanitation challenges.
So we are at Happy Kids Kindergarten. It's a community kindergarten on ECD Center. And what we do when we enter a community is that we set up what we call Sanitation Demonstration Center. These are the approved centers by the local authority, in this case the municipality of Windhoek. And these are then what we showcase to the community and also to the education institution to say kids need to be protected from using riverbeds. And because we also don't have access to water connections here, the idea of the TP taps is much important because it saves a lot of water and it's very easy to use for the kids. So this is basically a demonstration center. And then after we have done our community triggering and everyone in the community is aware of what type of toilet they are allowed to build, then we hand it over to the kindergarten to be utilized by the children. The implementation of community-led total sanitation is really holistic. because it's behavior change. We target everyone in the community, and if we want our community to be transformed, we also need to involve the children, not just the adults.
Good afternoon, teachers. Good afternoon, parents. Good afternoon, friends. My name is Manuel Agustino. I'm 6 years old. I'm a boy. When I grown up, I want to be a firefighter. Thank you.
In 2019, when we initiated Eben Community-led Total Sanitation, first it was a response to the outbreak of hepatitis E, but it was also a response to the falling apart situation of sanitation in Namibia's informal settlements. Yeah, you can see it's water is just running. That's the same water that you see running into the road. We thought, what is the best way to prevent this situation for the pandemic and also for the futures? So we started then building more toilets. We needed more toilets. Toilets was the solution. People in the informal settlement were practicing open defecation because there were no access to toilets. The public toilets were falling apart. Most of them were vandalized. They were very hazardous. This is not even a safe toilet for kids. You see how it is. So. And we started then building sanitation centers. And when we build a sanitation center, wherever we build, we train community youth so they can know how to design this type of toilet. So they can then go back in their community, set up businesses that will then feed this sanitation service gap. So this is where Pius Utoni comes in. He was one of the first youth that were trained on how to build this type of toilet. Yeah. So then he set up his business to be servicing this community and other communities in the informal settlements when it comes to building this type of toilets.
So I'm staying here in Litungwe, and I'm here as a contractor. Each and every day I have to receive a call from different communities to go and make for them toilets. I do really appreciate for it. I came here 2017. These riverbeds, you can't eat food here. You eat, but your heart is not happy. All the flies were there, just around there. And even in our houses, flies, they are just coming from the riverbeds, coming inside in our houses. Even if you were standing here, you will not breathe nicely. So it was a very, very contaminated air. As we can see all around here, mostly all the houses, they are now just having toilets. It's just because of that idea that we given by people from a development workshop. And us also, we had been trying to emphasize so that each and every one will know about the importance of the toilet.
So this is Pius' toilet. He built it from all recycled materials. So that's basically the solution we're trying to promote, that communities can actually intervene and be met somewhere with minimal support. They can actually remove themselves out of this situation. Pius is likely to take care of this toilet because he knows how it felt, collecting all these materials and making it from the scratch. For behavior change to be really active, they need to be involved. They need to learn how to invest into a toilet.
Betty Gebhardt also has a business, recycling other people's waste. Turning trash into treasure brings self-esteem and a valuable income to her family.
Die meeste waarvan ik hou, ochtend als ik opsta, dan voel ik moet gaan werken. This people of mine. Dan maak ik nu 3 jaar in hier development of workshop wat ik nu divert doen in our community. Die development wat nu ingekomen is wat nu weer bikkie bij die tafel nog die broodje van mij komt ingegeven dat ik ook mijn kind tot bij de school, tot wat hij in Yunam gaan. Want hij is nog het tweede jaar, hij is nog civil engineering. Dat is wat ik nog krijg. Echt hier altijd daar aan de kant toe. En ik zeg nog bij dankjewel voor de development of workshop. Want er is waar. Ik ga niet altijd, elke dag, ik wil niet laten gaan slapen. Ik ga niet dit.
So what they did is that they came up with the initiative of recycling. So they are also getting something from the recycling. So meaning we are turning this rubbish into something reusable that can benefit their families. And these ladies are very so much dedicated to the work.
Yeah,
You can see that since they are doing recycling now, our communities are free from diseases.
We are the Green Team CLTS!
The community-led Total Sanitation network of volunteers spread awareness about sanitation issues in their communities. They also act as sales agents and are encouraged to set up sanitation businesses.
This is my toilet.
Piers has constructed more than 100 good quality toilets using his jackhammer business.
Naritungwe, let's build it up. Yeah.
Other new sanitation businesses born out of the CLTS program include brickmaking, pay-as-you-go toilets, community recycling, and sanitation stores.
Ondiripongo mno ikariripo kanjuwaga osenda yetu yotete tatunga oikariripo no kanjuwaga no tabia talongi fo kanjuwo botafuto $2.
Put a sanitation center here, these blocks will also start building.
Development Workshop Namibia uses a GIS computer mapping system to monitor any changes in the sanitation situation on the ground. Information about sanitation improvements, such as the construction of household toilets, is collected by volunteers using a cell phone GIS app.
We have a standard that is set up by the municipality to say we start monitoring it from a pit since we have the app which we use with this phone. We take the GPS point of a place where is our toilet located. We take a clear picture of it and then we submit it into the forms.
Mr. Colin, how's it, boss? Yeah.
We can now see everything on the ground via satellite. DW Namibia can verify information as well as showcase and share best practices, highlight interventions, and evaluate the impacts of the CLTS program in any town of Namibia.
Yeah, we can put it in the middle to benefit more people, and when we get more funding, we can.
These are all materials that we actually just put together so that we can make a toilet for ourselves instead of us using the riverbed.
And how many people are using this toilet?
So far, let me say it's not more than 10 people.
Not more than 10 people.
Yes. My dear, I feel very proud living at my place. It's comfortable, it's green, it's clean. I feel very proud to be here.
The success of the CLTS project in Windhoek since it began in 2019 has led to the upscaling of the CLTS program across the country. DW Namibia employs the same CLTS methodology developed in Windhoek to upgrade the sanitation situation in other towns of Namibia, including using the GIS mapping system to do all their planning with local authorities.
This is all generated from our data that we collect just to produce maps. For instance, if we are going to a local authority here in Shakati, and these are the informal settlements, these are the boundaries that we have mapped, and we do this for every town we are working in, Chibarongo, Opuo, Keribib, Swakop, and so on. We can even map where people do open defecation, so we can indicate to the local authority that these are the danger zones. These are the hotspots of outbreaks and so on.
The map over here at the top, it's showing the 3 areas that are ODF free in Windhoek, but we have also done all of this across the other towns. We are celebrating ODF in 13 sections.
Ultimate is to cover all these blocks that we have mapped with all blue. And then we replicate the same to all the town where we're working in.
So addressing these things together with solid waste management is really absolutely essential to creating a more equal society in Namibia. And I think the work that DW has done in making this possible has been absolutely outstanding. I think the program has rolled from one town to the next, to the next, to the next. And once you have networks of people working together in informal settlements, you've now got community action, and they uplift the whole community. And if this continues, we should, in 5 or 8 years, depending on how much resources come into the program, be in a position for every town to have open defecation-free environments, to have litter-clean environments, and for people to really improve their quality of life right across the country.
Thank you, Namibia.
On the 22nd of April 2023, the community-led Total Sanitation program hosted a big party in the communities where they have been working in Windhoek. These were the first urban neighborhoods in Namibia to be declared open defecation free through the CLTS program. After years of hard work, it was time for the communities, DW Namibia and all their partners to celebrate their achievements together.
Good morning, goeiemorgen, wie geht's, mwapenduka, morokeni, omrinawa. Let's all stand up and clap our hands to Moses Garwe and Samora Machel for this historic achievement. Yaro, 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 yaro. This is a celebration of a status that we have achieved.
I therefore request that all of us should give a round of applause to all the 1,052 households, the first urban households to become open defecation free.
The community, together with the involved stakeholder, came together say, we must keep our community clean. How are we going to do it? And then the volunteers say we can go in the communities to educate them.
And I have understood that you have done wonderful work in that sense. We have to replicate it everywhere in Namibia.
It is also an opportunity to show that elimination of open defecation is possible with the communities taking a leading role.
Open defecation-free neighborhoods has made a positive, remarkable and tangible impact on communities that benefited from this support.
Moving forward, I encourage all the communities to safely guard their newly acquired open defecation-free status and to serve as an example for other communities to emulate this model.
Thank you so much for acknowledging our effort and for congratulating us for achieving the open defecation status. Are we together? Are you graduating today? Yes, we are graduating today.
Colleagues, this is our thing. This is our status. That's why you see everyone is here. Let's own it. Oshi masho shetu na tushi tambuliko de atu asikala shirime nyalatetu.
The eradication of open defecation must be a national agenda.
Take care for your volunteer so that they can shine a bit. We want all people are shining.
The volunteers, they are actually the soldiers who are spreading the information. We would like them to realize that what they have been doing is a huge investment in the Namibian child, in the Namibian people, and that this should really inspire them, because it's a noble goal, it's a noble deed to do that.
We really appreciate your coming to witness the celebration of the 3 blocks that were then open defecation, and they are getting their status today.
And the message, as you have heard it there, we must now replicate this in all other local authorities.
The community-led total sanitation program needs to be expanded and replicated across the country.
There we go.
Wow.
More funding is needed to enable Development Workshop Namibia to work together with her partners to build better sanitation infrastructure. So even though Windhoek is currently a tale of 2 cities, in the future we can improve the quality of life for every Namibian child and every family living in the informal settlements.
Ezebedete stwa kuyunga tetete kukusasewa toli kuhumononyara anodunako nonja kabisi kuja tupu
Nokasi yetu na ikare ya era Kanujoro wero teuga mena Ashisheshe tunashikare shayera Shimukore mutwako tamina Rukanda rwetu na rukare rwayera Kanujoro wero teuga mena Natango vuma ike yo majostera Wikare ke ike kokure nepera O hepatitis I mean nuvera Nimbo dingeno na ikare ke toto Amolamba ngeno na shikare ke poto Nori ni kosha wa mini kara inoto Onkifika una orongi fenguto Sunjoro